Now, this is a very important. This is a very important picture. You have to see this picture very carefully. This is how a cavity looks like. This is how a carious lesion looks like. This one. This is how a carious lesion look like. It has different zones. You will see this is normal enamel, and this is normal dentine. Normal enamel, normal dentine. This area, which you see black, if you see this black area, this is called infected dentine. It is purulent, it is necrotic, it is irreversible. This is called infected dentine. It has a lot of bacteria, it is unmineralized, it's dead, it doesn't have any sensation, and it's not useful. This has to be removed. Infected dentine has to be removed. Now, there is something called affected dentine. What is affected dentine? This area also has bacteria, few bacteria, but this can be remineralized. It is vital, it's sensitive, it is useful. Earlier, if you had to make a cavity, you would remove all this healthy tissue, healthy dentine, healthy enamel, infected, affected, everything. But in minimal intervention dentistry, we remove only the infected part of the dentine, which is useless, unmineralized, dead. And we use materials which remineralize the affected dentine. And which is the material which can remineralize? The material is called glass ionomer cement. Because glass ionomer cement produces fluoride. And this fluoride remineralizes the affected dentine. And it is also antibacterial. So it kills, it destroys any bacteria here. And the process is reversed. And this dentine becomes healthy again. But if you were doing regular dentistry with amalgam, you would make a whole big cavity for retention of box, remove infected, affected, healthy, all the tissue. But in minimal intervention dentistry, just this part, the infected part. Rest is remineralized and then restored. You can use glass ionomer here for remineralization. Over that, you can give composites. That's called the sandwich technique. Glass ionomer and composites. So see the difference between traditional dentistry and minimal intervention dentistry. And see the difference between infected dentine and affected dentine and normal tissue. We do not remove any healthy tissue in MID. We remove only infected, not even affected dentine, which can be remineralized. So this is one of the basic principles of minimal intervention dentistry. Now I'll teach you some techniques which you should use in the clinics for minimal intervention dentistry. I'll teach you some caries excavation techniques. I will teach you remineralization techniques. I'll teach you how we use ozone. I'll tell you something about ART. It's a practical later. I will tell you something about preventive restorations, and I'll give you some idea about pit and fissure sealants. These are all minimal intervention dentistry techniques. So let us see some of the techniques. So we start with caries excavation. How do we remove caries? How do we remove caries from the cavity? If it's a cavitated region, how do we remove caries? We remove caries using dental burrs. We use dental burrs, isn't it? We use burrs. And when we use dental burrs, high-speed dental burrs, there is excessive removal of dental tissue. You cannot control the removal of tissue because they're at very high speed. And they remove healthy dentine and enamel. Even if you try, it's very difficult not to remove healthy dentine, healthy enamel. And it gives a lot of sensitivity because there is pressure. And there is noise on the bone. There is vibration of the bone. There is sound of the handpiece. And there is high temperature buildup. So you have to use irrigants with the dental burrs. This is the common method for removal of dental caries. But this causes pain and discomfort. Well, you are creating the cavity preparation, you have pain and you have discomfort. And then there is a chance of removing healthy dental tissue. So now I'll tell you techniques which are used in MID for removal or excavation of caries. What are the techniques? The first technique, it is called chemomechanical excavation. Look at these pictures, chemomechanical excavation. So we have certain liquids, it's available in a dropper, which are put in the cavity. So once you put it in the cavity, it makes the dentine soft. It makes the dentine soft, very soft. And then you can remove it. You do not need a handpiece or a burr. You remove it by a spoon excavator, very gently. And you remove only the infected dentine. The dentine becomes soft. And these are usually sodium hypochlorite based agents, pepsin in phosphoric acid, sodium biphosphate buffer. So this is called chemomechanical excavation. You make the dentine soft with a chemical, and then you use a simple spoon excavator to gently remove the dentine. Did you remove any healthy tissue here? No. See this? Dentine became soft, and here is the cavity finally. No healthy tissue is removed. Oh, see the size of the cavity? Very small. And you did not remove any healthy tissue. Very easy and very soft technique. This is one, chemomechanical excavation. Number two, excavation by sonoabrasion. What does that mean? Have you seen a scaler? Yeah, which you use for scaling, for removing calculus. Now we have a similar instrument for removing caries. It produces sonic waves, sonic abrasion, vibrations. And these vibrations, when these vibrations are produced, the caries part and the healthy tissue, they vibrate at different frequencies. And the caries is removed. We did not remove any healthy tissue. This is called excavation by sonoabrasion. See this instrument? Produces sonic waves just like a scaler. And it removes only the caries part. It does not remove healthy tissue. Number three, ear abrasion excavation. So this instrument, it produces air at high frequency. And it has some abrasive particles in that air. Abrasive particles means somebody like silica, sand, or glass, small particles. And it removes the caries without removing the healthy tissue. This is called ear abrasion excavation. So we have chemomechanical excavation, we have sonoabrasion, and we have ear abrasion. Three techniques for caries excavation which do not remove healthy tissue, which do not cause pain, which do not cause much vibration. Clear? Did you understand these techniques? Now, how do we identify which caries is which part of dentine is infected and which is affected, which can be remineralized and which cannot be remineralized? Which part do we have to remove? So for that, we have these techniques to find out which tissue is infected and which is affected, which is healthy. Number one is called FACE, fluorescence-aided caries excavation. So what do we do in this? We have a slow-speed handpiece which has a fiber optic violet light source. It produces a fluorescent light. Have you seen on the roads when you are driving in the night and you put light and in the center of the road, it becomes fluorescent. It reflects the light in a way that you see fluorescence, or the jackets which have fluorescent strips, so that if you put light, you can see it in the night. Similarly, this handpiece has a fiber optic violet light. And when you put this light on a tooth, which has a cavity, and you wear these goggles, which are orange-colored goggles, when you look at the cavity, you will see that infected dentine becomes orange color. Orange color, infected dentine. See here, orange color. And you remove only the infected part. Here, you cannot see this picture properly. You see just the orange part. And when you see that part, you remove only the infected dentine. You do not remove affected dentine or healthy dentine because they are not in orange color. You just made the orange color. You can also get fluorescence by handpieces which have laser attached to it. So you put laser on the lesion, on the carious lesion, it absorbs laser and it reflects back. It is red colored. and you remove only the infected dentine. You also have caries detection dyes. See this? Caries detection dyes, they come in a tube. It's a liquid. You put it in the cavity and infected dentine becomes pink in color. See this? Pink color. And you remove only the infected part, only the pink part. See? Fluorescence. To understand that you have to remove only the infected part. You also have laser excavation. We use, instead of burrs, we use lasers. And with lasers, you can make very small cavities. It's antibacterial. And it decreases enamel solubility. The enamel doesn't get removed. Key laser excavation. Use lasers to excavate dental caries. So boys and girls, did you understand these cavity? Did you understand these two slides? One, how do we use excavation, caries excavation, and then how do we identify infected dentine and affected dentine? Any questions about this? Any questions? Any doubts, please? Any questions? Any doubts about caries excavation techniques and fluorescence to help in identification of infected dentine? Good. Next. Like we talked earlier, I told you we have, see this, white discoloration, incipient lesions. You can have even it as a white line here. You can see white lines, incipient lesions before and after. Incipient lesions, white discolorations. So we have something called remineralization. I talked to you earlier about remineralization. See, this is demineralization. What causes demineralization of enamel? What causes demineralization? Removal of calcium and phosphorus from the dentine, which are the minerals which hold it together. Bacteria, saliva is not good, tooth defects, and poor diet causes demineralization. So we have to do remineralization. What do we do remineralization with? Antimicrobial agents, antibacterial agents, saliva, the best remineralization agents, and good diet. This is remineralization. So if you have a lesion like white spot lesions, incipient caries, we do not make a cavity. See, for example, we'll not restore this. We'll remineralize. And as I told you earlier, saliva is a very good remineralization agent. But if you do not want to use saliva, you can use fluorides. You can use casein phosphopeptides, tricalcium phosphate, bioactive glass, xylitol, ACB technology, ozone, novamin, hydroxyapatite, and even laser. Laser causes remineralization. So look at these materials and you will think, oh, where can I get? This is too complicated. Check your toothpastes. Check your mouthwashes. They contain these substances. They contain fluoride, they contain bioactive glass, they contain calcium, they contain xylitol, they contain ozone, they contain novamin. All these are used for remineralization. So remember, in minimal intervention dentistry, if we see a demineralized area, we do not make a cavity, we remineralize. Clear? So this is remineralization, and these are the factors which cause demineralization, and this is how we do remineralization. And these are remineralization agents. And new era of dentistry believes in remineralization, not restoration of demineralized areas. Then we have something called ozone application. You know, ozone is a gas. You must have heard about ozone layer in the atmosphere. So we use ozone. Why do we use ozone in demineralized areas? Because it's toxic to certain bacteria. Ozone kills bacteria, and therefore it arrests the progress of a lesion. So when you kill the bacteria, say for example a lesion like this or a lesion like this. This is incipient caries. You know, it is yellow color, but it's incipient. It does not have a cavity. So what will you do with this? You cannot make a cavity here because we are MID. So what do? We use this equipment, which is called ozone generators. They produce ozone, and it is connected to a handpiece. From here, it is connected to a handpiece. And this handpiece has a silicone cup. And we place this cup over the tooth, and we flush in ozone. which can be gas, or it can be a solution, or it can be ozone water, ozonized water. We put it on the tissue, on the tooth. So what happens? Ozone flows into this incipient lesions, non-cavitated lesions, and it kills the bacteria. And once it kills the bacteria, we use it for a minimum of 10 seconds. For 10 seconds, we treat this lesion with ozone. And after that, once we kill the bacteria, we fluoridate it. We use fluorides to remineralize. So ozone helps in better remineralization of the tooth and also in killing the bacteria. And when it kills the bacteria, caries process stops. This is called ozone application. Next, another technique is preventive resin restorations. Preventive resin restorations. See, these are cavities, lesions. Can you see these lesions? And I know if you were in an preclinical operative class, you would make a huge class 1 cavity. I have shown you this earlier, huge class 1 cavity. But no, we do, like I showed you earlier, we do not make big cavities. We make small cavities. See this? Small cavities. And there is no particular design to this cavity. See, no particular design. And they are shallow. They are not deep. And then we use materials, resin materials, which are adhesive. You can even see a cavity here. Can you see a cavity here? Very shallow, very small cavity, and restored with a resin material, which can be a composite or which can be glass ionomer. Why? Because they are adhesive materials. They do not require the cavity for retention. They only are adhesive. They stick to the enamel and dentine so that the size of your cavities is extremely small. See here, extremely small cavities, using resin materials. We do not use amalgam. If you had to use amalgam here, you would make a large cavity, this much large cavity. And you would make it deep, how much? 1.5 mm below the dentine. So you will remove all the healthy tissue. No, not here. Preventive resin restoration, small cavities. Conservative tooth preparation. You do not make large cavities and you do restorations which are small. This technique is called atraumatic restorative treatment technique. It is a very simple technique and you will have practicals for that. Say, for example, this is a cavity. This is a lesion. This is a cavity. And you can see there's a brown area. There's a black area. This black area is infected dentine. This is affected dentine. This can be remineralized. This has to be removed. How do we remove it? With a sharp spoon excavator. Just seize this cavity. We do not use a handpiece. We do not use a burr. We just use a spoon excavator. We use a sharp spoon excavator. We remove the caries. This is how the cavity looks after the restoration, after the removal of caries, before and after. And then what we do, we take glass enamel and fill the cavity. Even we don't remove instruments. We fill it with glass enamel and press it with your finger. Put some Vaseline over your finger and press it. And remove the excess, check high point, the filling is done. 1, 2, 3. No handpiece, no burrs, no instruments, just spoon excavator and glass enamel cement. This does not take even 5 minutes. It is very successful in case of children because we are not using handpieces. We are not using anesthesia. We simply use a sharp excavator, remove infected dentine. This is the cavity and fill it with glass enamel. Now glass enamel, antibacterial, permanent filling, tooth color restoration, remineralizes dentine, and there is no leakage. The treatment is done in less than 5 minutes. If this was an amalgam filling, you would make a big cavity. You would make a deep cavity. You will remove infected, affected, healthy tissue. And it would take about, how much? 20, 25 minutes. But no, minimal intervention dentistry. Just remove infected dentine. Make the cavity clean and restore. That's it, done. This is called atraumatic restorative treatment, and you will do it in your clinics when you join in level 9. Now, this is another one, which is quickly I will tell you. It's called interim therapeutic restoration. See this? Sometimes we have cavities. We have many cavities in a child. Some cavities like this. And these cavities are producing bacteria. They are producing bacteria. So if you have a child who is not cooperative, who is not opening his mouth, and you see cavities like this, so you do not stop by restoring each cavity. No, what we do is we excavate and fill. So what are we doing? We are reducing the number of bacteria. You can give a temporary filling for the time being so that the bacteria are stopped. We do not go too deep to expose the pulp. We remove it from the walls. We just give a temporary filling so that we can do a permanent filling later. But if you keep this cavity open, this will produce bacteria and they will cause caries in the other tooth also. So what we do in the first sitting is cover all lesions, remove whatever caries we can, don't expose the tooth, and give a temporary filling to stop bacteria. This is minimal intervention dentistry. We saved this tooth because we covered the bacteria, we removed the bacteria from the other tooth. Then we can come back later and do a proper filling. But for the time being, we prevented caries in this. Minimal intervention dentistry using interim therapeutic restoration, sometimes and in children who are not cooperative. Then, this is called pit and fissure sealants. Look at this. This is a non-cavitated lesion. And bacteria have gone inside the pits and fissures. So we use materials called pit and fissure sealants. What do? We seal it. We clean the area. We do not make a cavity. We just clean the area. See, we clean the area. We apply acid for acid etching. This is after acid etching. See, we didn't make any cavity here. Earlier, what we used to do, if we have a cavity like this, we make a class 1 cavity. No, here what we do, even this is a non-cavitated lesion, a non-cavitated lesion, a non-cavitated lesion. This is cavitated because you have a cavity. We clean the area. We do acid etching, and after that, what we do is we put material, we apply, we stick a material to these pits and fissures. We sealed it. So these bacteria, which was causing caries, are eliminated. And no new bacteria can enter the pits and fissures. These are called pit and fissure sealants. Pit and fissure sealants. We do not make a cavity. We clean the area, we etch the area, and we seal the area using pits and fissure sealants. Minimal intervention dentistry. Then, finally, all of you have to become minimal intervention dentists. Please do not make large cavities. Please remove bacteria from the oral cavity. They will control the disease and you will not get caries in patients. Make your cavities as small as possible. Make your restorations using adhesive materials, which is glass enamel cement and resin composites. Dentistry is moving towards MID. Amalgam and metal restorations are finished. Do not tell operative people this, I said this, but they are finished. You have to be minimal intervention dentists of the future. Thank you so much. And once you come to the clinics, we'll discuss MID in patients, how we can do MID in patients. If you have any questions about this lecture, please ask me.